I'm Dr. Arjun Guraj, a staff electrophysiologist for Nevada Heart and Vascular Center in Las Vegas, Nevada. I'd like to take this opportunity to speak to you about closed-loop stimulation. Closed-loop stimulation, also known as CLS, is a novel sensor technology that BIOTRONIK has. As you know, there are very little long-term data regarding the effectiveness of the sensor. However, I'd like to show you two patients in which we do a test to demonstrate the effectiveness of the sensor. The test will use a non-exercise task and we'll compare the sensor to the standard accelerometer sensor in most pacemakers. The test is called the Stroop test, which is a colored word test, a bit modified, and will be discussed by my assistant.
Thank you, Dr. Guraj. The color word test is a series of slides with a single word written on each slide, and it's written in a certain color. The subjects are supposed to identify the color seen on the slide. For example, the slide starts out with the word red, and it's written in red. But as the slides advance, the word written and the color represented might not match up. At the same time, the amount of time to identify each slide is reduced. The purpose of this test is to increase heart rate in the subjects without exercising. Instead, it is through acute mental stress. As you'll see in this test, one subject will have a pacemaker with CLS on, and one subject will have a pacemaker with accelerometer on. Each patient will have a 12-lead EKG to monitor their heart rate to indicate what the pacemaker is doing. Our goal is to see if CLS responds differently than a pacemaker with accelerometer on. Our hypothesis is that the subject with CLS on will more mimic a natural heart rate during the test, and the subject with accelerometer on will not show a change in heart rate. Let's see what happens.
What we see here are the representative ECGs of two patients undergoing the Stroop test. Both patients have chronic atrial fibrillation, they both have had AV node ablations, and they're both chronotropically incompetent. The left EKG shows the patient who's undergoing the Stroop test with CLS turned on, and the right EKG shows the patient with CLS turned off. As you can see on the left side, there's an increase in heart rate with mental task of doing the word test without any physical activity as the patient sitting in the chair doing this test. On the right side, you could see the patient remains at their baseline heart rate without any increase in the heart rate, even with the Stroop test, when the patient is not doing any physical activity. This is a great example of how CLS shows an increase in heart rate with mental tasking, which is very similar to what the sinus node does in the normal state of someone who's not chronotropically incompetent. I hope this demonstration convinces you that CLS not only responds to the exercise capacity of patients, but also the non-exercise needs of the patient as well, such as mental tasks. And I hope this video allows you to understand CLS better.